So something that I know was tricky for me was learning rhythms, reading strips. What are some ways that we can prepare for that, even before going to the bedside in nursing school, or after the fact, just, studying when we get home and getting better at reading those and interpreting them?
Right. So I think before you even go into taking a course on learning how to read arrhythmias, I think it's important to just go back to the basics and at least start learning the electrical conduction system of the heart, because that is the backbone of all the arrhythmias. Once you know the conduction system, how the electricity moves through the heart, it makes sense when you're reading your rhythm strips and stuff like that. So just go back to the basics, learn the anatomy of the heart, blood flow of the heart, electrical conduction system. Start off with those three things, and that will set you up for a lot of success when you do take your telemetry or ECG courses, whatever it is that you are taking. And then once you're actually in the course itself, I think finding kind of like a method that works for you when it comes to reading strips and sticking with that. For me, it was these 5 steps. So first thing was measure R to R. Is it regular or not? Look at your rate, look at your PR, QRS, and QT. If you do this every single time, those 5 steps, you're bound to find what your rhythm is. There's no way that you're going to miss anything. So if you continuously follow these certain steps, whatever works for you, whichever method works best for you, as long as you're sticking with the same kind of routine when it comes to reading your strips, I think you're going to be set up for success in that way. But along with that, doing practice questions when you're in the actual course, practice questions or practice strips, and just reading those in your spare time, trying to analyze what this rhythm is, what the treatment for this rhythm is. I think that's just going to do everyone well. So that's what I would suggest.
And I was going to say, in critical care fellowship, for me, practice was really key. My specialty is neurosurgery. Of course, I do have to have a cardiac background. I wouldn't say it's extensive, but in the ICU, you need to know a little bit about it. And there's so many online resources and websites that you can just log into and do a lot of practice strips.
Yeah, I found that even when I was in my course and I had my textbook, I really enjoyed going online and doing those strips, or even because I work on a cardiac floor, I just wasn't technically allowed to do any telemetry patients or anything like that because I wasn't trained. So I would look at my coworkers' patients on the telemetry screen and just practice reading the strips if I had some extra time. And those strips versus the strips that you see in the book are fairly different. The book gives you some very nice, pretty P waves, QRSs, and then when you get to your actual telemonitor, you're like, that's not what it looks like in the book.
Doesn't always look like it does in the book. Yeah.